Yeah.
welcome. I did quickly introduce you and let everyone know that you are indeed an alloy prescribing physician. What I had not gotten to let everyone know is that you are also a practicing OBGYN in the Los Angeles area. Where exactly?
So I am in Burbank.
In Burbank. Okay.
Yeah, I'm in Burbank.
Okay.
So yeah,
Well,
that's
welcome. Welcome. We are talking perimenopause today. We're talking about sort of the lesser known symptoms, which I've thought about this for many years now in having the many conversations that I've had. And it sort of occurred to me that the lesser known symptoms aren't really lesser. They're just maybe not so spoken about, and they're actually quite common. So I wondered today if we might start with your sort of grounding us, reminding us about perimenopause. We shouldn't assume that everybody knows about it. And really, I think to the point, you can have an array of symptoms that you would not associate with the hormonal fluctuations of perimenopause. So if you could tee us off with a perimenopause definition,
yeah.
and then start us down the road with what was your personal introduction to this conversation.
Yeah, well, thank you so much, Rachel, for having me on this Instagram Live. I really enjoy working with you because I think you're just phenomenal at really highlighting the importance of like education and us knowing what's important, because we're always going to encounter a healthcare system that doesn't always know, may not necessarily be educated. And I think it's easy as a healthcare provider to just dismiss like, oh, that's nothing. And I was in that experience as well. So I get to speak about it and also share my experience so that others can also know just how important it is to educate yourself so that like you are aware of what may happen as your body's changes, right?
Yes, thank you.
Yeah. So I'll start with just sharing a little bit about what is perimenopause. And for those who may not know, I know there's a lot of information out there, but the basic definition of perimenopause is essentially like the period leading to the time that your ovaries gradually stop working. Okay. And you think of, okay, we know what menopause is. Menopause is 12 months without having your menstrual period, but then peri means around, right? Around menopause. So it's actually the 7 to 10 years before. So because menopause doesn't just happen like this, it's a gradual process, right? Where your hormones start to decline, and it can be characterized by a few things. Everybody's going to present differently. So it's not a one size fits all. Some women may start to notice some changes in their periods. Like they may notice that their period, the time between that, they have periods is shorter. So like every 21 days. Some women may notice they have like episodes of prolonged bleeding, with their periods. Like it's, oh my gosh, it's lasting 20 days. Why? And some other women may notice that they just have heavier periods, right? So it can be characterized by that. Not necessarily, not everybody has that. So we say that and or the symptoms of menopause, right? Because you start having the symptoms as your estrogen levels start to decline or they start to fluctuate, right? They're not necessarily following the normal bell curves that we, are used to in our premenopausal years. So your body's just like gradually getting to that place where, your ovaries are eventually going to stop working.
Okay. So to that, let's get into some of these symptoms. So take us to this moment that you had. Yeah. And then we'll start getting into the symptoms and then the questions that came in for you.
Sure. So my experience was one that was a bit traumatic. And for those of you who don't know, I'm a practicing obstetrician gynecologist. So my last 20 years plus has been characterized by 24-hour shifts, sometimes working 36 hours. And, and I would use my contacts and really didn't ever have a problem with it.
Your contact lenses?
Contact lenses.
Okay.
Out when I needed to. And, sometimes when you're working those shifts, there's not a lot of time to really hydrate yourself. So, I just, again, 20s, 30s, you just
Go.
work it. You just do to get through. And so I recall, and again, I'm 50 right now, so 49 was last year. And so this is an incident that happened to me last year. I was getting ready to go to a women's physician's retreat. So I literally finished doing a 24-hour. I kind of had a few hours to sleep, tried to get in front of the computer and do all my, messaging to patients. And, so there was an increased amount of screen time involved for me.
Mm-hmm.
And I remember waking up early so I could drive from LA to San Diego, because San Diego is where this, women physicians retreat was. And so that's like a 2.5 hour drive. Got my coffee, got on the road, got there, had coffee. That first night they had a bonfire, and, there was champagne. So, I kind of was like, okay, I've always been able to figure out, how to manage all this. And so, and I had a great time.
Yeah.
But the next, I woke up and I had taken out my contact lenses during this time, but, to sleep. But I woke up and it felt like there were shards of glass, right? Like scraping my eyes just to open my eyes. And I remember feeling really sensitive to the light. And I remember feeling like, oh my gosh, like what happened? Did I accidentally sleep with my contacts? And of course I saw them in the case. And so then I was like, oh my gosh, maybe let me just get a cold compress or a cold towel, put it over my eyes, and that should fix it. And then I can go back to all these great activities that were planned. Okay. And tried that for 10 minutes, didn't work. And then I literally was like, started to panic and get afraid. Like, why is it that I can't see? I'm not able to open my eyes. And I recall one of the physicians literally had to walk me from the hotel room to the front entrance because I was so sensitive to light. It was just pain, intense pain. And I just was thinking to myself, oh my gosh, I'm with a group of female physicians, but there's not a whole lot they can do for me to fix this pain now.
Yeah.
Nobody has, suitcase with medications, diagnostic kits. So I asked one of the physicians to take me to the emergency room because I knew that, like, I was scared. I was like, oh my gosh, did I have a blood sugar of 500? Because, high blood sugars can cause problems with your vision. I'm thinking, do I have a brain tumor? Because why all of a sudden can I not see? Why is it that I'm having all this pain? So there was so much fear. And I remember one of the physicians took me to the ER. She had to fill out all my paperwork, my insurance information, because of doing that. And I remember feeling so helpless because I couldn't even, I can do anything. So finally the doctor sees me and he diagnoses me with a condition that, he put a bunch of stuff in my eyes, thought that it would helped for 5 minutes. And then I really reverted to where I was. He diagnosed me with a condition that welders get because of the bonfire. He thought, it might be a condition that welders get when they get like a flash of light that impacts their vision. So it's a condition I think called photokeratitis. And I thought to myself, goodness gracious, number one, how am I going to get home? Because I can't. Number two, how long is this thing going to last?
Yeah, I have babies to deliver.
And I was terrified because what does this mean for my career? So again, my husband had to take a train to come all the way and get me. And I had to wear these goggles because I just couldn't, the light would impact it. And a couple days later, I obviously couldn't work that week, but I ended up going to an ophthalmologist. And I was fortunate enough that this ophthalmologist was a female and she was in her 50s and 60s. She did my exam and she said to me a few things. She said, okay, I see this really significant inflammation and it's a very underdiagnosed condition. And it's called it's a severe form of dry eye. And this can happen with a few different things. It was probably the perfect storm because number one, okay, the chronic contact lens use. Number two, screen use. And number three, she said, hormonal levels decline. And with that decline comes an impact on tear production. So when your hormone levels start to decline, your body is no longer as capable producing like not only the quality of tears, but also the quantity of,
Right,
tears
right, right,
at the surface of
right.
that eye. So you end up with a severe dry eye. And she's like, you're on this medication now for $700 a month,
Wow.
which again, she said you're on it for the rest of your life. But I just wish that I had known, you know,
Hmm.
that this is something that even though I was able to get through like, my 20s and my 30s, like when I get to the time that my hormones start to decline, I need to take better care of it.
Dr. Dombo, if I can just jump in for a minute,
Yeah.
you're making me think of several things. One is that there may be conditions that you are teed up for that present in perimenopause as a result, and correct me wherever I'm wrong,
Mm-hmm.
that present as your hormones are fluctuating.
Yeah.
That's one thing. Then there's a conflation with what sounds like a particularly dehydrated many hours for you. You mentioned coffee a
Yeah.
lot, and then being in this dry, brittle, ashy place, things coming at you. And
Yeah.
then what I'm also thinking is that the sort of the fortune that you had in finally connecting with a physician who, like you yourself now, was going through exactly the season of life that you
Yeah.
almost needed her to. Now, that's not to say that physicians can't and won't and shouldn't, and we see more and more of this now,
Yeah.
become educated about perimenopause and menopause and its impact on all aspects of our health. But
Right.
it's really quite special that you had a doctor who recognized
Yeah.
that this could be a thing. So
Right.
all of that sort of comes to mind, and I'll let you speak to that if you like. But I
Yeah.
also, people are starting to chime in and say things about their eyes as well. And so I'd love it if we can start going through in a moment some of these quote unquote lesser known symptoms.
Yeah. So I think for me, right, like what would have been so great to know as I had been getting my eye exams every year was, okay, like, yeah, there's a process of aging, but there's also this decline in hormone levels. And it just means that, like right now, I have a humidifier going
Mm,
to keep the
mm,
like moist because I know that my eyes need, and this is the one time because my ophthalmologist was like, contacts are going to be out the door. Like she said, you are able to wear them very seldom and select times, but that's not going to be a common thing for
mm.
you. It's not going to be a regular thing for you anymore. So,
Wow.
this is something that, so now I have to kind of look at, okay, well, what do I want to do? Do I want to get laser? Like there are other things that now I need to consider. And I think, again, if I had only known that fear that I had going,
Mm,
I'm thinking, oh my life, like you feel like your career flashes in front of you thinking, you realize how valuable your eyesight is because
yes.
I mean, I had a friend said, I'm not coming to a blind doctor. She was like, you know what I mean?
Yes.
She just was like, out of all the
Yeah.
faculties, thing,
We want you all to be able to see us.
right.
So that leads me and you directly to this, because what you are interested in, what you are so passionate about, is educating all the women you access, and letting them know sort of what is potentially coming down the road, so that fear is eliminated,
Yeah.
so that there can be attention given to what ails you. So your eyes, you may not have known that this was going to become a problem, but you might have sort of thought about having a humidifier handy, giving your lenses a
Yeah.
break, making sure you're hydrated, things like this. Does that make sense?
Right. Yeah. And then also with computer time, because
Mm,
I like telehealth. And so I'd be in front of the computer sometimes before bed, like for
yeah,
3 hours, just
yeah,
trying to messages. And that wasn't a good thing, for me. It obviously was one of the things that also took me over.
yes,
So what I do now is take breaks, so I'll be like, okay, an hour in the morning, maybe an hour in the afternoon, an hour in the evening. I'm not
yeah,
going to lump all my, time in front of the screen, because when you don't
right,
blink, right? When you screen and you're not blinking, that also tends to dehydrate your eyes. The blinking process is what really helps to lubricate your eyes.
Right.
You need good quality tears.
Interesting.
And
Yeah. Yeah. Okay. Thank you for sharing that, Dr. Dombo. It really, it resonates, and it's helpful always to hear that physicians are like the rest of us going through it. Okay. Now you have a list of symptoms, if you
yeah,
will, and we can start to go through those, and then, sort of as much or as little time as you want to spend. And then I'm going to get to questions that came in.
yeah, sounds good. Do you want me to go through the list, or would you like me to just address what has come in so far, so that we can kind of maybe address those things first, and then
Okay,
anything
let's do that. Let's do
way
that. Let's get to the questions, because there may be. Yep. Terrific. Okay. Question 1. Does MHT or HRT improve symptoms of vertigo if started once a woman has vertigo, or is it only preventative? This was interesting. I love this question. A lot of people chimed in about dizziness, and I asked you, and I said, don't tell me the answer, but is dizziness the same as vertigo? Would one be diagnosed interchangeably?
Yeah. So I think there's a fundamental difference between vertigo and dizziness. So when you think about vertigo, vertigo is the experience or the sensation that either you're moving around or the room is moving around you. So it's like really related to like a sense of movement, like something's spinning in the world. And so the way that like perimenopause, hormonal fluctuations can contribute to vertigo is that, that inner ear, like that is responsible for our, balance, our sense of balance. So when you start to have, like, especially in perimenopause, these wild fluctuations in hormones, or at like a decline, in your hormone levels, that is going to impact that functioning of the inner ear. So if you notice that you're starting to experience it newly, then, my gosh, like that probably is related to that. If you've had vertigo in the past, it's hard to say whether you notice. I mean, the question that I would probably ask that patient is, have you noticed a worsening in your vertigo? There's clearly maybe some underlying condition that probably contributed to you having vertigo prior, to perimenopause. And then with these fluctuations in hormone levels, is that what's contributing to it maybe potentially worsening, during
Okay. And so it stands to reason that hormonal treatment, or perhaps for some patients, the birth control pill, something that sort of levels out your hormones, would be helpful.
Maybe help, but also realize too that even if, let's say, you start on like one form of, hormone therapy, it may take a little while before your body stabilizes to the point where that symptom goes away, because everybody different formulation may be better, and that is a trial and error, right? So I want patients to understand that, or people to understand that even if you do start, menopause hormone therapy, it's not like, oh, it's a quick fix. It's really trying to figure out what works best for each individual person. Because if you are at a stage in perimenopause where you're still having those wild fluctuations, or if you're closer to menopause where it's like you're on the real decline, you're going to have two different responses if you add hormone therapy. So it's like I tell patients all the time, it's a journey for us to discover what works best for you, because
I love that.
Everybody else are not the same person. Right.
That's such a great reminder, given really any symptom as well, because I, for example, was helped with sleep night 1. It took a few more days to resolve my hot flashes and night sweats, but the anxiety took a little bit longer. It got there, but it did take a little bit longer. And it was just sort of hanging in there and keeping track of your symptoms and sort of the frequency, the severity, to sort of help you out, help you realize that you are getting relief. Thank you. Thank you for that. Okay, next question. This was actually many questions, but I'm going to read this person's as it came in, because she said something quite poignant. My question is a little embarrassing.
Okay.
No, I don't want her to feel that way, but a lot of people do. I'd love to know more about changes in body odor.
Mm-hmm.
I stress sweat when I have hot flashes while I'm working out, working in big meetings, etc. I've noticed that lately when I stress sweat, my body odor is next level. Is this related to the menopause transition? Or is it that my sense of smell is heightened? And is that also related to the menopause transition? Should
Right.
I start taking body deodorant everywhere I go? Lots of questions, but it's become a new and embarrassing struggle, which makes the sweat worse. If I can say truly again, many people asked about body odors, mouth odor. Those were the two specifically, but I actually did a post yesterday because so many people sort of piped in with this sense of shame and privacy.
Sure.
And I just shared that there was a season where before I started MHT, where when I was sleeping and night sweating, I felt like I smelled like meat. Like I couldn't describe it any other way, but it was
Yeah.
awful. It did resolve, but it was awful. So please
Yeah.
take it.
And yeah, no, I also hear that from patients as well. And I remember when I, a couple of years ago when I started, I was like, huh, that's really interesting.
Hmm.
But really, this is part of the reason why, like when you start noticing, like increased perspiration and increased sweating with the hot flashes and night sweats, it's going to lead to body odor, right?
Mm-hmm.
Because you're sweating more. So that's one possible reason for that. And the other thing is like when you have these hormonal fluctuations, they can also lead to an increase in odor causing bacteria.
Okay.
Again, I can't know exactly why, but the fluctuations, and again, perimenopause is a time of wild
Yeah.
fluctuation. Okay. So it's not surprising that, these odor causing bacteria are responding to that kind of environment within your body. And that can contribute to, you
Okay.
know, a
So
body
perfectly
odor.
normal and probably very common.
And one thing, okay, so this is one thing that, we usually say may be helpful, right, with this is it's just layering so that you can,
Mm.
like if you notice that you're sweating, poof, you have one layer you can take off, and then you have another layer. Like, so it's just really either packing for, different shirts or just somehow layering so that you have options when you feel like you're sweating and perspiring so that you can actually change, your whatever it is
Right.
that you're wearing.
Right. Okay. Thank you.
Yeah.
Next, this was also a asked a lot in preparation for our call. I'd like to hear more about anxiety and treatment. I've never had it in my life until perimenopause. Um, this person is using MHT. It hasn't yet helped relieve her anxiety, nor has SSRIs. Is
Mm-hmm.
there any new evidence that suggests testosterone might be helpful? I know that's not something we offer yet,
Yeah, yeah,
but can you speak to the anxiety part, which was another
yeah,
frequently asked question?
yeah, absolutely. So it's so interesting because I think the traditional and the typical symptoms that we learn in medical school, so like hot flashes, night sweats, and vaginal dryness, those are the traditional symptoms when you go through menopause. And so when you encounter the health system, anything outside of that
Yeah.
may not necessarily be fully understood. So it's really great that these questions are being asked because, knowing the fact that we notice an increase in mood symptoms, when you're in perimenopause. And here's the reason why. So like estrogen helps support like the feel good brain chemicals. Serotonin, epinephrine, norepinephrine are the feel good brain chemicals. And estrogen is really responsible for supporting, them in your brain. So what happens when you start having these wild fluctuations, right, in perimenopause, or you start to have a real decline? I know I use my hand because
No,
it's just,
no, no, right. We
know,
love it.
the stabilization of serotonin and norepinephrine is like literally disrupted.
Mm.
So things that, people tend to notice are either panic attacks, anxiety, mood symptoms. And so our brains are left with fewer like tools to cope with these stressors. So a lot of women may describe the time as, man, you know, I used to be able to cope with this kind of stress in my life, but I just can't do it anymore. And
Yeah.
I like, you know, from a mood perspective, this is just not something that, you know, I feel like I'm falling apart. And so it makes absolute sense because, again, it's those estrogen levels that start to decline or fluctuate that really impact the stability of serotonin and norepinephrine in the brain.
Okay, thank you. This was another one. Ear ringing.
Mm-hmm.
And this one came up a lot also, this skin
Yeah.
sensation, a feeling of bugs crawling on you,
Yep.
certainly dry skin and itchy skin.
Yeah.
But could you address the ear? And
Yeah.
again, maybe that's like a tinnitus thing.
Yeah.
I don't know. Yeah.
So, okay. So what tinnitus is? It's like
Tinnitus.
ringing in. Yeah, it's
Okay.
ringing in the ear. And again, it goes back to the same reason why patients experience vertigo.
Mm-hmm.
So that inner ear is responsible, or its functioning is dependent on estrogen, right? Like smooth estrogen levels. So when you have a decline or fluctuation, it's going to impact your inner ear. And that is what causes the tinnitus, vertigo, some of those symptoms that are responsible and controlled by your inner ear.
Okay.
That's the reason.
Okay. And then the skin, the bug
Yeah.
sensation.
Uh-huh. So basically the sensation of, okay, so I'm going to distinguish because there's sensation of, you know, it's as if bugs are crawling on your skin. And a lot of times the low estrogen levels can contribute to dryness in the
Right.
skin. And that sense of dryness is where you experience like a sense of like, you know, bugs crawling.
Ugh.
There's the side where some people experience electric
Yeah.
shocks, right?
Yes.
Shocks, you know, and it's because estrogen has a direct impact on the functioning of the central nervous system. So if you feel restless leg when you try to go to sleep and your legs are just like moving left or right, and I felt that, and I just was like, what the heck is happening? First my eyes, now my leg,
Right.
you know what I mean? And you feel like you're falling apart. But restless leg syndrome, it's simply because estrogen levels are responsible for like the proper functioning of the central nervous system. And so the tingling, the shocks, restless leg syndrome, all of that is related.
Right. Dr. Dombo, I kind of consolidated several questions. So we more or less hit them all that came in, but you brought up electric shocks, which was pretty specific. And I know in your list of things, another thing that I'm thinking of, because when I was thinking of body odor and mouth odor, was teeth problems that are quite common. And it may start as aches and pains, and I don't know, just a weird, I recently had something just kind of sort of resurface for a second and then go away, but it reminded me that my teeth had been a real
Yeah.
problem a couple of years ago. Can you talk about
Yeah.
that?
So, when it comes to dental, teeth, periodontal degree, you know, disease, teeth sensitivity, teeth floss, because you can also experience like the loss of teeth. So,
Changes in taste, that's another one.
yeah, so
So weird.
that's a
Okay.
separate one. We'll deal with
Okay.
dentist.
Okay, I'll stop talking. I
Okay.
get too excited.
So,
Okay, go ahead.
so the issue with, okay, so there are a couple reasons. When you think about like, you know, your teeth, you have your jaw, right? And your jaw, like, you know, when estrogen levels, here's my
Yeah.
hand again, estrogen start to decline, what happens is you've noticed like a thinning, right? A thinning in your, you know, your bone density goes down. So now
Mm-hmm.
your jaw, it's the ability to anchor your teeth is reduced, right? So now that puts you more prone to periodontal disease. That puts you more, you know, oops, my lighting went off. It puts you prone to, yeah, periodontal disease. It puts you, you know, prone to that gum sensitivity. Like you tend to have more inflammation. And then you also tend to have, you know, bleeding gums. So
Oh,
being able to identify that, and this is the one thing, like, especially for, you know, women who are juggling multiple things, Sometimes I'm like, I don't have time, to go in to get my teeth cleaned. But this is another thing that is so important because you are at just higher risk of periodontal disease. And so with that, you need to go in like at minimum twice a year, to get reassessed and assessed so that you're not causing these permanent
Yes.
lasting, right? To
Yes.
and
Critical.
and I didn't know that. I just felt like I wish that I wouldn't have put off, because I'm just too busy, to go and make sure that I do it twice a year this week. Once should be good enough. But
Yeah.
no, bodies are changing, and the resilience that we were able to have, in our 20s and 30s may not necessarily be there as we get older. So that is part of the reason why we have issues, with with teeth.
With teeth.
And I think one of the reasons is the type of bacteria that are normally because we have, okay, this goes to, again, I think you asked about burning mouth, or
Yes.
was that
And taste, which you said was
a,
separate. Mm-hmm.
yeah. So when your estrogen levels start to shift, it changes the viscosity of your saliva. So your saliva, yeah. So basically what happens when you have that change, the type of bacteria that's used to existing in your mouth can be replaced by a different kind of bacteria. And so that's going to impact not only your sense of taste, but also like, the experience of like burning mouth, because again, with lower estrogen levels, there's lower moisture. And all those contribute to the symptoms that are like burning mouth, dry mouth, differences in taste.
I want to say, just pause for a moment before we kind of run through some of the other things, but if there was ever an illustration as to the fact that estrogen impacts every single part of you, this conversation is the illustration, because there's no part of us, you would in your list talked about hair loss, nails, which you can expand on as much as like, allergy symptoms, which I'd love to home in on for a moment. Um, all of this is related to, as you illustrate, the decline, the fluctuation in our hormones. Primarily, we're speaking about
Yeah.
estrogen. So please go on. But I guess I say that all just to say that if you are a woman post 35, let's
Mm-hmm.
say, coming upon this conversation, and it strikes you that from head to toe, any number of symptoms that seem to have come out of nowhere, or maybe you had like an occurrence with in your 20s, but that's been quiet, and now it's louder and more frequent, i.e., vertigo. It is a time to sort of seize the reins on your health and appreciate that hormones are available to you as a first line of defense in many cases to things sort of increasing and getting worse. And certainly going for those checkups, getting your teeth looked at, getting your hearing checked, whatever it might be. Does that make sense? Does
Yeah.
that sound appropriate?
Being more consistent and more vigilant,
Mm-hmm.
because again, small changes can make a difference. Just as I said, like, okay, I'm going to monitor my screen time. Okay, I'm going to reduce my stress, right? Or what are some things that I can do to reduce stress, like medicating? Or in addition, like, I mean, not everybody's going to want
Right.
hormones, but it's like, can you support your system
Yes.
so that you are able to navigate this time without the fear? Because I know when your body starts shifting and changing and not doing the same thing that you were able to do for several years, it can be scary and you can feel like you're falling apart. And yet that's not what's happening. It's just, how do you support your body during this time?
Yeah.
How do you have a plan that ensures that all your organ systems are supported and taken care of, and what you as an individual, what you need,
Yes.
because it's not the same for everybody.
Yeah.
It's going to be nobody. Others may not have as dramatic of an experience that I had with my severe dry eye, but they may have a severe dramatic situation somewhere else.
Yeah.
right? So if
Yeah, I love that. I so appreciate your saying that. It really is time to sort of home in on you,
mhm,
really self-assess in a way that maybe you hadn't previously. Dr. Dombo, can you speak a bit to histamine and allergy symptoms? That's another one. And then I know I have to be conscious of your time, but
sure.
yes,
Yeah,
please talk about that.
definitely do that. So there's a connection between the release of histamine and your hormone levels. So, there's a cascade of events that happens that causes the release of histamine. Let's say you're exposed to an allergen or something, like there's this cascade of events.
Mm-hmm.
But basically, when your hormone levels start to shift, there's this overfiring of histamine. So you may notice that you have some allergy symptoms. And some of these allergy symptoms are like runny nose,
Mm.
they can be, like, sneezing, hives, itchy nose. And it's funny because I remember for myself personally, I was cooking dinner one time and I started, I just was sniveling. And my husband was like, ooh, don't go close to the food if you ate, But then,
Right.
I was like, wait a minute, and I don't know. I'm not saying that in every single person who has
Sure.
this goals I mean, you got to make sure it's not anything, right?
Mm-hmm.
But it's known that fluctuations in your levels of estrogen, they can cause an overfiring of that histamine response, leading to some allergy symptoms that, let's say, you have a history of allergies and what you were using before is not helping anymore, or you're all of a sudden noticing a consistency in allergy symptoms, but yet you're not
Right.
necessarily things. So it's just listening to your body and determining, okay, if I'm not feeling sick, if I'm not, the doctor can't find anything, could this possibly be, a symptom?
Okay. And is post 35 fair to say that if you are, and I know, there are those in early menopause, there are those who've gotten a hysterectomy actually,
Mm-hmm.
who also um, wrote that certain symptoms became louder for them post hysterectomy. Actually, someone here I can see wrote, I had eye issues after when I had my
Mm-hmm.
hysterectomy. So any other sort of flags for people that they might be aware of, or
Yeah. So here's what I say. So again, just to start with your first question
mm,
about anybody over 35, right? So I think if you have an idea or a sense of the age that your mom went through menopause, that tends to be a good predictor, not the perfect predictor, but a good predictor around when you may encounter it yourself. And so what we say is, like, again, 7 to 10 years before that age is where you may start to notice symptoms. For patients who've had like a hysterectomy, even if they left your ovaries, anytime, there's manipulation of your, ovaries, whether it's instrumental manipulation or even just feeling them to make sure that they're normal, like that can actually impact the proper functioning of your ovaries. So even having a hysterectomy with your ovaries left in place, if you start to experience symptoms, that doesn't mean that it's in your head and let's say you're
mm,
still maybe 39, right? Like it could be that the hysterectomy itself, the fact that you had your uterus taken out, and there was a little bit of handling of your ovaries, that could impact their functioning. And as a result, you may experience symptoms. And just because you're 39 doesn't mean that you may not need assistance.
right. Thank you for that. um Finally, Dr. Dombo, when we had a little time to prepare for this conversation, um you mentioned sort of the for lack of a better word, kind of the preciousness, the how special telehealth can be, and I always think when I have these conversations about how unique a space Alloy is, in particular, that we offer women physicians who are trained, especially in menopause care and
Yeah.
all of the nuances of
Yeah.
that. And I'm thinking about women in perimenopause who may or may not realize they're in perimenopause, and how unique and special an experience it would be for them to come across a physician like you, or the eye doctor that you had an interaction with, who acknowledges and listens and offers real help. And I don't really know that that's a question so much as
Yeah.
a comment. I'd love to hear your
Yeah.
thoughts on.
Yeah. So I'll just share this about myself. So I did my residency training in 2001 to 2005. The WHI came out in 2002, okay, where it was like hormones are bad. So my training incorporated a little bit of the, noise, right, that came as a result of, the fear that came with that study. And so for me, it wasn't until about maybe 2 years ago that I really started to delve in and do a deep dive into, okay, my friends were asking me questions. Like, I don't know, you've got to
Right,
find some.
right.
And then, as I also went through my own journey, I started to realize, okay, this is important information because I don't know and I need to learn and I need to develop, like, so what I love about Alloy is that we have a group of physicians. We're all committed to, even if we're still, in a process where we don't know all the answers,
Mm,
are able to network with one another and be like, hey, Dr. Malone, or hey, Dr. Mann, or hey, Dr. Gandhi, or hey, Dr. Culver. Like, we're able to come together
I
and
love that.
share
Yeah,
information to be able to help our patients, because we don't always know all the
right.
answers. We're, as physicians that have been trained a certain way, where hot flashes, night sweats, vaginal dryness is
Is
pretty much
the trifecta. Yeah, that's it.
so.
Yeah.
It's like, how can we, and then, there are other people who are blazing the trail, like Dr. Mary Claire Haver, Dr. Avon Brumling, there are people who are out there blazing that trail. So it's like, how
You're
can
blazing it too, Dr. Dombo.
how can we all come together to share this knowledge so that we can actually help patients? Because what is happening is, by no fault of the health system,
Right,
because people just
right.
haven't been educated. Like that guy who told me that it's welders,
Yeah,
eye disease,
sure.
he was just doing the best that he knew how,
Mhm.
right? It didn't help my, anxiety. But when I talked to somebody who was able to actually, like, have gone through the process herself, she was an ophthalmologist and she could target that, wait, your estrogen levels are declining and this is
Right.
the, you know, it's contributing to the issue. It's nice to be able to have a place where you can talk to doctors who are trying to educate themselves to help women with all these symptoms that
Yeah.
people may not be able to put together. And you may, again, and there's so many stories of people who've been sent to different doctors, right? Oh, you have this problem, go to this doctor. Oh, you have this problem. And so being able to put it all together sometimes can be helpful
Yeah.
for those.
Yeah, yeah. I thank you for that. I could go on and on speaking with you. I really do just
So we'll
love
do
it.
a webinar.
We'll do a webinar. Yes, everybody watch out. Dr. Dombo is going to. I have finally landed her plane on a webinar with me. I thank you so much for this. We touched on, I believe, all of these sort of, as I say, quote unquote, lesser known symptoms of perimenopause. I'm sure that this conversation has sort of widened the eyes of many women who, again, may or may not know, may or may not realize, may not be putting those things together. And certainly, we are a platform in the business of helping women like that to feel better and address all of those symptoms. And so I encourage people out there who will listen to hop over,
Yeah,
find Dr. Dombo or any other of our fantastic menopause trained physicians, and have a conversation about what's nagging you. Dr. Dombo, you're just exceptionally lovely and wonderful and helpful, and thank you for this time.
absolutely. You're very welcome. And again, as I've learned, it's like there've got to be so many other women who don't know. So it's like you're like putting
That's the
forth
thing.
the information
That's the thing.
so that there's awareness.
Yes. Yeah. Yes. That is my hope, that we will just keep amplifying this. And perimenopause is, it's a long time. It's where all the heavy stuff happens, and is a time to, as you say, look within, self-assess, find out your information, get educated, get your solutions wherever they may be, lifestyle, hormonal, both, and sort of shore yourself up
Yeah.
for a nice, long, healthy
Yep.
life. Thank
Sounds good.
you. Thank
Yeah.
you, everybody who joined. Thank you for your questions. Dr. Dombo, we will speak
Sounds
again.
good.
Okay. Bye, everyone. Thank you.